Welcome to today's press briefing. We have two doctors with us, Dr. Zhang Shukwan, the head of Communicable Disease Branch, Center for Health Protection, and Dr. Lau Ka-hin, Chief Manager of Hospital Authority. They will give you an update on the HA situation and COVID-19 cases. We start with Dr. Lau. Good afternoon. Let me briefly report on HA situation. We have 2,627 confirmed patients in our facilities. 349 of them are new cases. And for those requiring isolation facilities, 517 are in isolation wards, 171 in second-tier wards, and 638 others in Hong Kong Infection Control Center of Hong Kong Lantau Hospital, and 199 in Asia World Expo treatment facility. 224 of them are new cases. Yesterday, we also received 7 more patients in critical conditions and 21 in serious condition. And among the inpatients, there are 48 in critical condition and 58 in serious condition. And 14 patients in critical condition are now in ICU. In United Christian Hospital, this morning, there was a report about a child in critical condition. A 15-month girl had fever on the 30th of August with an RAT positive result. And starting in the small hours of today, she got infected. Her case has been confirmed, and she was admitted to A&E department, followed by a transfer to the children's ICU unit. And afterwards, she stopped convulsions, and she could be spared from breathing support, but because of her condition, she's now listed as in critical condition. As for death cases, there are 11 more death cases, 5 males, 6 females, from 78 to 94 years old. 7 of them did not complete the 3-dose vaccine regime, and 1 of them did not have any jab at all. And among the 11 death cases, one was an 80-year-old male patient who suffered from chronic diseases such as hypertension, a history of stroke, and bladder cancer, as well as dementia. On the 28th of August, his family members found him unconscious at home, and he also produced vomit similar to coffee, the color of coffee, and he was suspected to have fainted because of digestive illness. The ambulance was called and resuscitation was administered. He was then taken to UCH A&E unit, and in the A&E unit, the heartbeat could not be resumed, and he was declared dead. He was a care home patient. In the residential care home for the elderly, he was found unconscious. On the 28th, the RCHE conducted a test for the patient. The result was positive, and the result was also declared on our platform. And according to our colleagues in the hospital, despite having a positive result of COVID, his death may not be related to COVID-19 because of the coffee-like vomit. He was suspected to have intestinal bleeding, and his case has been transferred to the coroner's court, and the cause of death will be determined. As for the remaining 10 cases, the deceased aged from 78 to 94 all had the chronic illnesses, including DM, hypertension, renal failure in the late stage, stroke history, dementia, as well as arrhythmia, and also ventricular fibrillation. We believe that for the 10 death cases, the cause of death have to do with COVID. As of yesterday, 310 patients have recovered, including 280 who have been discharged from hospitals, and 10 patients are found to be positive by hospital admission screening, and 17 other patients in the same ward are listed as close contacts. As for HA staff members, we have 174 more members infected with COVID, and also 17 patients in the same wards are listed as close contacts. Now, I'd like to make an announcement relating to the cluster in the surgical ward of UCH. For the mixed surgical ward of United Christian Hospital, on the 30th of August, a 77-year-old male patient tested positive for COVID, and the hospital started contact tracing. Subsequently, 4 more patients in the same ward, aged 52 to 82, have been found positive, and they are 3 males and 1 female, and they are now isolated, and their condition is stable, and the ward has suspended visiting arrangements, and the ward has been thoroughly cleansed and disinfected. The hospital has also arranged for all patients and staff in the same ward to get tested. The hospital will continue to monitor the condition of patients and staff members and will closely liaise with the Center for Health Protection for follow-up action. Good afternoon. We recorded 10,342 positive cases, including 3,091 PCR positive cases and 7,251 RAT cases. We also have 244 imported cases, including 215 PCR positive and 29 RT positive cases. For the 224 imported cases, 73 were picked up at the airport, 81 were picked up in quarantine hotels. As for the cases identified in the 4th to 7th day in the community treatment centers, there are 72 cases, and 13 others have been picked up during the 8th and 10th day of their arrival. These positive cases come from 46 countries, and there are 6 countries, including Philippines 27, Thailand 27, UK 23, India 20, US 19, and 13 from another country. These countries have imported more than 10 cases in the past 7 days. As mentioned by Dr. Lau, we've recorded 7 new death cases, and the total death count in this 5th wave now stands at 9,488. We have 6 residential care homes for the elderly and for the disabled with cases testing positive, and some will have to be quarantined. Faito home for the aged in Tuen Mun, 1 resident infected, 6 residents to be quarantined. Gong An Wu Lao Yun in Kwai Chung, 1 resident infected, 7 residents to be quarantined. Donggang Sang Shui An Lao Yun in North District, 1 resident infected and 1 resident to be quarantined. Yan Ngoi Wu Lao Yun, the first branch, 1 infected, 7 to be quarantined. Nam Hua Wu Lao Yun 第一分院, 1 resident infected, 4 to be quarantined. Kwai Fong Gui, 1 resident infected and 7 to be quarantined. As for RCSD, Yiyan Sanchong in Sha Tin, 4 residents infected and 1 staff member infected and 6 residents to be quarantined. As for schools, we have 84 schools reporting 139 positive cases to us, including 113 students, together with 26 teaching staff. They are from 32 kindergartens, childcare centers, 25 primary schools, 24 secondary schools, and 3 special schools. In the past 7 days, 12 schools reported more than 2 cases in the past 7 days to us. And today, we've advised certain classes of 5 schools to be suspended for 1 week in Yuen Long, Hip Hong Society Sui Bin Wai Center, a special childcare center. The taxi class, we find 1 student, 1 teacher infected. It will be suspended for 1 week.
Tuen Mun Class 1E has 30 students and 4 have been tested positive. They need to suspend classes for a week. In Yuen Long, we have another kindergarten. They have 2 classes. 7 people were infected. Class NAM session, Group B, 13 students and 3 students and 3 teachers. In K1B, Group B, has 15 students and 1 teacher plus 1 student. But that teacher also teaches another class. Carmel School in Yunlong, K5E, 30 students, and the teacher was infected. They have to be suspended for a week. And in Yunlong, K3 class, 36 students, and we have 3 teachers infected from the Assembly of God Kindergarten. And previously we had Wong Lok School. They have another class 3-2. Class 3-2 has 20 students, and 3 students have been infected in recent days, and they also have to suspend for a week. Separately, today is the first school day. Education Bureau has informed students and teachers to do testing. So roughly in the last 3 days, there should be about more than 550 positive cases, and they didn't go to school today. Regarding the mutation strain, today BA.4/5 mutation strain, the ratio has increased slightly. It's about 60%. If you work out the ratios, then BA.5 is 52.8%, BA.2.2 is 33.5%, and the rest are BA.4 at 7.2% and 6.5% for BA.2.12.1. I also want to highlight that school has started. The hospital authority figures are going up, and we see in the coming few days we're seeing some serious children cases. We don't want to see this occur, so we urge everybody to get their children vaccinated, and the government will reduce the vaccination passport age to 5 years old, and they need to get 2 shots. And by next week, we might have some details coming from the government. So there will be about a 2-month transition period for parents to get their children vaccinated. That concludes my report today. Q&A session. Before you ask questions, please identify your media outlet. Now TV, first of all, we now have more than 10,000 cases, so how does CHP assess the risks in the future? What will the trend be? Will we need to tighten social distancing? And for designated venues, do we need 24-hour RAT testing? And regarding the child case, you said there was a 15-month baby girl. So aside from the 15-month baby girl, how many infected children are in ICU in serious condition? Now, previously there was a 17-month male boy. There is a rumor saying that he has meningitis. Now, the CE has said that there are talks with the mainland regarding reverse quarantine. So is the loop area in a standby mode? So will the whole premises be set aside for quarantine, or have we set aside some space in case we have a larger outbreak? Well, you see the figures are going up. Hong Kong U ratio is 1.36. It's going up. And we see BA.5, the trend is going up. And roughly half the cases are the mutation strain. So there is room or a possibility that it will go up. So we cannot predict how fast the cases will increase. We're keeping a close eye on the number of hospital admissions or the capacity of hospitals. The HA figures are more concerning. We hope that the number of cases don't have a negative impact on hospital services. Regarding the CE's quarantine policies, I know that there are some experts who will weigh in on this issue, and we can hear from them. The 17-month Princess Margaret boy, yesterday, the doctors did a test for him, and it was acute meningitis arising from COVID. So the hospital is providing care for meningitis. He's intubated. His vital signs are stable, but he's in a serious condition. Now, we also had a case in Tuen Mun Hospital, 5 years, 9 months old. She is still in ICU, and if you include today's 15-month baby girl, just now we said she had fever and convulsions. So they are in ICU right now, but they can breathe on their own. They don't have any more convulsions. Brain scan indicates that everything is normal. So I want to inform everybody that a lot of experts, we've recently had 4 experts weighing in, saying that the most effective way to reduce serious symptoms, such as high fever, fever leading to convulsions, we also want to prevent severe meningitis, and we also want to prevent inflammation, so vaccination can protect children. Whenever we talk about children, it's heartbreaking and it's saddening. If you can use the opportunity to get vaccinated, get your second, third shot, and if you're infected, then it reduces the likelihood of serious complications, and even we don't want to see a death. Next question. TVB. We've now exceeded 10,000 cases. Dr. Chuang said that back compared to February and March, people's immunity might have been compromised and they might be reinfected. So will we see another peak of 50,000 that we saw in March? Will there be compulsory vaccination? Will the 4th jab be made compulsory? We're also worried about the number of hospital beds. AWE is now almost at full capacity. So when will AWE deploy more beds, and will we be needing assistance from the mainland? We don't want to see a repeat of the 5th wave, where we had more than 50,000 cases, and the majority of the public have received the booster shots, and we hope that we can do a better job there. And if the immunity is compromised, that's inevitable. But if you've kept up with your jabs, we hope that we won't see a repeat of the previous peak. We're also keeping an eye on the reinfected cases, and so far, compared to the last, it's about 1.something%. That is the number of reinfected cases. Regarding AWE, today we have providing 240 beds. We have some private doctors helping out, and the government is also providing an extra gratuity for government staff, so they are able to provide service for 240 beds. We're keeping an eye on the number of admissions, the number of serious critical cases. As a matter of fact, we do see an increase, and we hope the public do their part and get their jabs, wear masks, and wash hands, and they need to get jabs, and if you're infected, they need medical care as soon as possible.
Because only by doing so would you be able to avoid hospital admission and alleviating the pressure on the public hospitals. It's much more convenient now. You can use the teleconsultation service, and you can also visit the private clinic. So patients will find it easier to see a doctor and get the medication they need. And we also have help from private hospitals. Cases can be transferred to private hospitals to alleviate the pressure on our system. Concerted effort is needed in order to tide us all over. Next question. This reporter in grey.
Okay. The total cases have reached 10,000 today. So would you expect cases will continue to rise? And even on the rise, have you noticed any increase in serious cases? And also, the government has announced plans to extend vaccine pass to those as young as 5. So how effective do you think it will boost vaccination rate among young children? Thank you.
We still have an increasing trend of the number of confirmed cases. So the number of cases exceeding 10,000 is within our expectation. The proportion of severe and death cases has not yet been increased, but of course the absolute number has been increasing because of the increasing in the denominator. So we will be closely monitoring the situation, and we are more concerned about the burden to the hospital authority, the bed numbers, and the services. And we would like to encourage the children to receive vaccination as soon as possible, especially before the winter season, because so that the government is planning to reduce the age limit of the vaccine pass to 5-year-old.
Next question. On the left-hand side, this gentleman. AM 730. Good afternoon. There are 520 cases involving students who did not go to school. Is it within your expectation about the classes to be suspended for a week, as you announced today? Did they relate to earlier infections? And what about the total number of students and teachers who have reported testing positive today? As for the vaccine pass requirement, there is a consideration to reduce the age limit to 5 years old. How would the government consider that the fact that children may not have their mobile phones? And what vaccines should be administered for children? Is it Sinovac or BioNTech? And according to a counselor, there are people who have reported their positive RAT results on the platform and waiting for confirmatory tests, and they waited a long time before being sent to the isolation facility. Is there any flexibility in terms of the waiting time? For the figures announced today, we're referring to students who have been going to school. So we have 139 testing positive. Today is also the start of a school year for many schools. And for those testing positive today, 147 reports were received this morning. These students do not go to school. But as we understand, 1 or 2 days ago, they also conducted tests. 212 on the 30th tested positive, and 194 tested positive on the 31st. Well, these figures seem to be lower than what we expected in terms of the proportion of students in the community. That should be at least 1/10. But I suppose students and teachers have meanwhile scaled down on their activities in the community as they get ready for school. As for vaccine pass, I understand that not all of them have mobile phones, so it's all right to use other alternatives. As for the RAT positive results, after the results are declared on the platform, and once you have uploaded your identity documents, and once we issue an isolation order, the case will then be referred to other government departments, and the subject will be transferred to an isolation facility if necessary. It doesn't have to do with the final check. The total number, how many school children did not go to school, or did go to school rather? Some 590,000 students, as well as 90,000 teaching staff went to school today. Next question. Left-hand side, this gentleman in white. I'm from Ming Pao. Dr. Lau, about the 17-month boy, he was admitted to hospital 1 week ago. Do you have these analysis about the 15-month girl? She's now in the ICU, so she's been classified as critical condition. But are there special circumstances to list her as in critical condition? Can you provide more information? Second question, has the HA revised the criteria for patients having received vaccination before they're discharged? What is the original arrangement? Now is a CT value higher than 32. And for this new group of patients, would they be regarded as having recovered and yet to be discharged? And why didn't the HA fine-tune the arrangement before redeploying hospital beds? And the third question, will you consider shortening the interval between the second and third jab? And there are different definitions for children of different ages in terms of completing the vaccine regime. Why is it that the government stance is that 2 doses should be completed? We want to make it simple, so at the moment our criterion is a 2-dose regime. As for other details, we should wait for a further announcement from the government. As for the 17-month boy in Princess Margaret Hospital, as mentioned just now, having done some tests, the diagnosis is acute meningitis caused by COVID, and relevant treatment will be provided. We'll keep in view his situation. He is now intubated, but his vitals remain stable. As for the 15th-month girl, she had 3 rounds of convulsions, both before and after being admitted in the hospital. She also had fever. So to play safe, we've admitted her to ICU, and any patient in the ICU would be regarded as in critical condition. But her vitals are stable, and she does not need breathing support. And we've also conducted a brain scan, and we have not identified any major issues so far. As for the criteria for removing the isolation order of a patient, we have made some adjustments. Having taken the advice from the CHP, starting today, we have fine-tuned the arrangements for cancelling the isolation order of confirmed patients. Now, for patients who have not completed the 2-dose vaccine regime, the patient should be isolated for at least 14 days. And the isolation order will only be scrapped if the patient meets other clinical conditions. Under the new arrangement, even if the patient hasn't completed the 2-dose vaccine regime, as long as the CT value of a test conducted at least 7 days after she's been confirmed is greater than 30, then the patient will be deemed as having met the criterion for cancelling the isolation order. And if that is the case, the patient can be arranged to be discharged, but then the patient may also have other issues other than COVID. And in that case, these patients will be transferred to other wards for further treatment.
Our experts have looked at the latest trend of the epidemic and looked into the data, and we believe that if CT is greater than 30, that means that the patient is not infectious and they can cancel any quarantine orders. So doctors will consider the clinical data and the overall situation. So we don't want to increase the pressure on, we don't want to be overburdened. We want to set aside more beds for new cases. So patients with mild symptoms, they can be followed up in community centers. So if we make good use of our beds, we can reduce the need for adjustment of services, including non-emergency surgery. We want to see our beds being used efficiently, and we don't want to cut services. So we need to strike a balance, because aside from COVID patients, there are non-COVID patients every day receiving services, receiving treatment. Some of them might be cancer patients. We don't want them to wait for surgery. So these have to be calculated very carefully. Next question. I want to follow up on the number of death cases today. Which patient did not receive the jabs? And the 7 people who didn't have 3 jabs, could you disclose more information? Why are you not providing more information? And the 15-month baby girl, have the family members been infected? What is the source of infection? And have they been vaccinated? And lastly, on AWE, does HA have the capacity to add the number of beds to 300? And looking at the current trend, we already have more than 10,000 infected. So when do we need 300 beds in AWE? Regarding the 15-month-old baby girl, my information indicates that she had not been vaccinated. So we urge parents to get their children vaccinated, because if they are infected, they can have milder symptoms. It can reduce the number of the possibility of seizures. It can also reduce meningitis, the likelihood of meningitis. She lives with her grandmother, and the grandmother had RAT positive. The baby girl's mother sent the daughter to the hospital, and the mother was also tested positive. The mother and grandmother have received 3 jabs each. Coming back to the patient with no vaccination, she is a 94-year-old patient, has diabetes, hypertension, blocked airways, anemia, and had difficulty breathing at home for a few days, had a fever. On 20th of August, she went to Tin Sui Wai A&E, RAT positive. Her lungs were opaque, and CT value was 18.7. When she was admitted, we had prescribed different medication, including Reservidir, but in the ward, her condition deteriorated, and she passed away on the 31st. The other cases are similar. Of course, the number of vaccinations would be different, but they all have chronic disease, and when they were admitted to hospital, they had COVID symptoms. They were RAT positive, PCR positive. So when the hospital sees their background condition and COVID worsening their condition, and that led to their death. What was your other question? AWE. As I said just now, we would like to use existing resources to handle patients, including hospital bed, AWE beds. So in AWE, before we add extra human resources, we are deploying private doctors. We don't have to deploy doctors from the clusters. We have private doctors and nurses. And we also have staff working in AWE. They are given an extra gratuity to work overtime, so we can add the number of beds to 240. So we will keep an eye on the situation. We're now in phase 3, when we have more patients. Other beds that were reserved for other specialties, we might have to convert them for COVID patients. But we don't want to do that too abruptly. In principle, our hospital beds should be reserved for non-COVID patients. So when we adjust the services, reduce services, we don't want to have a large impact. But we're keeping an eye on things. We need everybody's cooperation, because if the infection cases go up, and if you have come down with mild symptoms, you've been vaccinated, you can rely on oral medication, you don't need to be admitted to hospital, that can relieve pressure in hospitals. So if everybody does their job, take medication, get vaccinated, don't go to hospital, don't be admitted to hospital, then we don't have to sacrifice non-essential services. Cable, the quarantine, how do you apply the latest rules, and when the age for the vaccination passport is reduced to 5 years old. So the 2-month grace period, is that enough? Because we're worried that parents will have to take their kids to get vaccinated. Is that enough time? Today, Professor Lau Yong said that he estimates that WHO will declare COVID to have come to an end by the middle of next year. So the public might only need to wear masks when there are special events or special occasions. So is that a possibility? We urge parents to get their children vaccinated, and we hope the government has provided sufficient time and resources, so the details will be announced a bit later. Regarding Professor Lau's opinion, I respect his opinion, but I don't have inside news. If they have symptoms on the first day, or when the sample is taken on the first day, if it's positive, we label that day 0, and then we move on to day 1, day 2. So if they don't have the dates, the RAT or PCR positive will be labeled as day 1. Well, that concludes today's press briefing. Thank you.